This study looked at the glottal attack and offset time during connected speech in adductor spasmodic dysphonia. This project was executed in the Analysis of Voice and Hearing Laboratory at Michigan State University, with the data that was obtained at Mayo Clinic, Arizona. Our researchers would like to acknowledge funding from National Institutes of Health, NIDCD, and Michigan State University's Discretionary Funding Initiative, as well as Michigan State University's Trifecta Initiative Matching Funds Award. Adductor Spasmodic Dysphonia, or ADSD, is a voice disorder that disrupts laryngeal muscle control during speech. Case history, auditory perceptual voice evaluation, and videoendoscopy are widely used for diagnosis of spasmodic dysphonia. However, spasmodic dysphonia misdiagnosis with muscle tension dysphonia and vocal tremor is common. Therefore, we need to develop better objective measures that can help with the differential diagnosis of ADSD from similar voice disorders. Although videoendoscopy is useful, it only shows the gross movements of the laryngeal tissues. Given this, we cannot measure the intracycle vibratory characteristics of the vocal folds using this method in patients with ADSD. High-speed videoendoscopy, or HSV, during connected speech is a new tool that enables us to study vocal fold vibrations in detail during running speech, which is the goal in this study. Our long-term goal is to develop HSV-based measures that could help in more accurate diagnosis and differential diagnosis of ADSD. The objective of this study was to measure the glottal attack time, GAT, and glottal offset time, or GOT, in subjects with ADSD. High-speed video was used to measure the GAT and GOT for vocally normal adult participants and adults with ADSD. GAT and GOT were measured for all vocalized segments of the connected speech. Participants in this study included 3 with no history of voice disorder, 2 females and 1 male, and 4 participants, all females, with confirmed diagnosis of ADSD. These 4 participants have had a confirmed diagnosis of ADSD from a voice evaluation and laryngoscopy during both sustained phonation and connected speech. These participants with ADSD had also not undergone recent voice therapy or Botox treatment at the time of data collection. All participants were between 35 and 80 years old. A Photron FASTCAM Mini AX200 monochrome camera was used for data collection. The HSV recording was done at a rate of 4,000 frames per second. The data were obtained from each participant during reading of 6 Cape V sentences and the Rainbow Passage. 2 raters visually analyzed the HSV data using a playback software, PFV4 Photron FASTCAM Viewer, with a playback speed of 30 frames per second to measure the durations of glottal attack and offset times. The glottal attack time was defined as the time between the first oscillation of the vocal folds and the first contact. The glottal offset time was defined as the time between the last contact of the vocal folds and the last oscillation. The visual analysis of the data was performed by viewing the HSV images frame by frame using the camera software. Within the software, the raters were allowed to play the HSV data forward and backward as many times as was needed to locate the timestamps as accurately as possible. The raters determined the timestamps for the first glottal contact and the first oscillation to measure GAT. The raters determined the timestamps for the last glottal contact and the last oscillation to measure GOT. This graph shows the mean and standard deviation of the combined participant data, grouped both by attack and offset time, as well as ADSD and norm. In green on the left, you will notice the norm data, and in pink on the right, you will notice data from participants with ADSD. Solid fill represents GAT, and stripes represent GOT. Our results indicated that the mean GAT, or glottal attack time, was slightly longer for participants with ADSD compared to the norm, and the mean GOT, or glottal offset time, was shorter for participants with ADSD compared to the norm. The standard deviations for participants with ADSD are considerably larger than the standard deviations for that of norm, with the biggest difference occurring in the standard deviation of GOT. The standard deviation for ADSD was nearly 10 milliseconds longer. This graph shows the individualized means and standard deviations for each participant. Again, on the left, green, vocally normal participants, and on the right, pink, for participants with ADSD. In looking at GAT data, 2 participants with ADSD, S6 and S7, had slightly larger means than those of each norm, and 2 had very close mean values for GAT. In the glottal offset data, 3 participants with ADSD had shorter mean GOTs than norm. Additionally, in the GAT and GOT data from participants with ADSD, one will notice the standard deviations are larger in comparison to the standard deviation of norm. In these graphs, you will see the range of data collected from each group. On the top left, combined GATs for all norm. On the bottom left, combined GOTs for norm. On the top right, combined GATs for participants with ADSD. And on the bottom right, combined GOTs for participants with ADSD. Each instance of measurable glottal attack and offset time are shown here, so the range shows a more complete picture of the data. When comparing the GAT of subjects with ADSD to norm, you notice that there are more outliers within the ADSD dataset. When comparing the GOT of subjects with ADSD to norm, you'll notice that the ADSD data is more widely spread, while the norm data are condensed and remain fairly consistent. In the GOT data for participants with ADSD, there are many values of 0, but few for the data for the norm. Mean GAT for participants with ADSD was slightly longer than that for norms. Mean GOT for participants with ADSD was slightly shorter than that for norm. With a larger subject pool, we might expect larger differences in mean between participants with ADSD and normative data. Standard deviations were greater on average for participants with ADSD than norm. The GOT standard deviation results are particularly compelling and suggest that GOT are more variable in participants with ADSD compared to that of norm. In the HSV data from participants with ADSD, we observed that toward the end of vocalization, the vocal folds adduct at their contact and struggle to abduct again. This led to GOT of 0 for a noticeable number of vocalizations in ADSD. The few GOTs of 0 looked different in vocally normal participants. It was more of a slowed halt. This study showed that glottal attack and offset times can be measured from HSV data during connected speech. Differences have been observed for GAT and GOT values between norm and disorder. However, this study used a small sample size. We also needed to use descriptive statistics due to the small number of participants. In the future, we aim to obtain more data and use structured statistical analysis to draw more robust conclusions. The data collection for this study is ongoing, and we plan to have a balanced number of males and females to account for any possible gender differences. Our goal is to be able to use these quantitative measures as biomarkers to study mechanisms of voice production in patients with ADSD. Our researchers would like to say thanks for stopping by and listening to our presentation today.